morning, everybody, including our witness and all the members of the committee. So I welcome Mr. Azar, our Secretary for HHS. I appreciate his coming before the committee to talk about Health and Human Service proposals in the President's budget for fiscal year 2020, I should say. Congress decides how much the government spends and how to allocate these resources. The President gets to have his say, and it's our duty to consider those recommendations. Or another way, sometimes I say that, a President proposes, but Congress disposes. We're here to discuss the part of the President's budget and the recommendations in regard to programs in the Department of Health and Human Services. These programs impact the day-to-day lives of many people in Iowa and throughout the country, adding up to about 130 million people just on Medicare and Medicaid. Human service programs administered by HHS help millions of families in need while promoting upward mobility. The programs this committee oversees spends over $1 trillion and takes hundreds of millions of dollars to administer. The President's budget proposal aims to tackle a number of pressing challenges. It looks to get a better handle on opioid epidemic, and it looks to improve child welfare outcomes. This committee has been active on these issues and others, of course, and has a role in overseeing that HHS implements the laws that Congress has passed in these areas. The budget of the President's also strives to lower the high cost of prescription drugs, which I have not heard a person on this committee say it's always a necessity to be working in that direction, and we haven't done enough. I share that goal with the President's budget and look forward to working with my colleagues on this committee to find ways to make medications more affordable in Medicare and Medicaid while protecting taxpayers who fund these programs. We all know that last June, President Trump and Secretary Azar laid out something to help reduce drug costs for patients, and I think they deserve tremendous credit for taking that route. Their sustained efforts have helped to make big drug pricing policy changes possible that probably haven't been done yet, but and this committee is working on it as well. The budget serves as a reminder that Congress needs to act to make sure that Medicaid and Medicare are around for future generations. Putting these programs then on a sustainable financial path while ensuring patients can get their care they need is obviously hard work, and we don't tackle it enough, sometimes not at all. And I've said many times, regardless of the issue, the legislative heavy lifting needs to be done in a bipartisan manner to achieve a lasting solution. This hearing then provides an opportunity to talk about issues important to our constituents and the entire nation. So whether you agree or disagree with the specific policy proposals in the budget, it's important that we engage with this Secretary on these issues. So we appreciate, Mr. Secretary, your being here to perform the time-honored tradition of testifying on the budget, which enables us to execute our duty to consider the President's proposals. I look forward to a robust discussion.